Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to the last episode of the Summit series. That's right, we leave the best for last. That's right. Today we're talking with Dr. Ross Ramsey. Now, he has been on the podcast before. We've shared some of the great things that are happening up in his region at his hospital. President, CEO of Scheurer Health. Dr. Ramsey, it's great to have you here again, talking about the things that matter to you the most. First and foremost, you are a physician, so you have a different perspective than most guests that are just the suits, because we're not physicians. But for those of our listeners who may not know you or have heard your first podcast, why don't you talk about a little bit about yourself and then about Scheurer Health?
Yeah, absolutely. Thanks for having me today. As you mentioned, I am a physician. I'm a family doc by training and still practice. I see patients in the outpatient setting 2 half days a week, which certainly keeps me in touch with
incredible.
The community.
It is incredible that you still, as the CEO and president, and now even busier, that you're still seeing patients. Yeah, it's a great way to connect.
It is, and it helps me also identify stumbling blocks or other issues in the system way better than just being out and about in the organization.
That's right. So Scheurer Health, talk to us about a little bit about the makeup, the composition. You had a recent change. Talk a little bit about that.
Yeah, so we historically have always been a one hospital system, right in Pigeon, Michigan, in the thumb. And we've actually had Harbor Beach Community Hospital, another critical access across the county, join our network as well. So now not only do we have a chain of pharmacies, a couple senior living communities, a few other odds and ends, but we also have 2 hospitals now as well. So I'm CEO of the entire network, overseeing everything, but then still the president of the hospital there in Pigeon with all of our operations.
Yeah, and critical access, for our listeners who may not know what a critical access is, can you let us know?
Sure. Critical access, one of the big things with that is it's a back-end mechanism, how we're reimbursed from Medicare. But ultimately, we're a 25-bed hospital, so we're small in a rural area with a few other strings attached to that.
Just a few, right?
Just a few.
So let's talk a little bit about the success of your organization over the last 12 months. You've been in your role for
about 2.5
years. Yeah, which seems like it was just yesterday, doesn't it?
Yeah.
But 2.5 years. So let's talk about the last 12 months of your organization. Talk about any successes that you're most proud of. What has happened in the last year since we've talked last?
It's been extremely busy last year. I have focused a lot on making sure that we can bring care as close to our community as possible, so they don't need to travel far to do so.
Right.
We have much more elderly population than many areas. And as a result, they need to travel to specialists. So we've worked hard to bring a lot of those specialists to the local community. We've now employed everything from pain management to urology, neurology, a lot of those specialties that they'd otherwise travel far for. Yeah. So that has led to a lot of growth for us. But in the same regard, we did have Harbor Beach Community Hospital become part of our network as well.
That's big.
So that's been where the bulk of my time really has been over the past year.
Yeah. Did they become employees and you had to go through the whole process of integrating them? And
they're still a separate entity.
That helps a little bit.
It does, but they're part of our network. Yeah. So there's a lot of alignment.
Still a lot of alignment that you have to do.
Correct.
Well, let's transition. So those are the great things that have happened for you, and certainly a lot of growth. I've had an opportunity to see some pictures of your beautiful campus. You've had some renovations. You got some renovations going on. Very exciting. But let's transition a little bit to what we're facing as an industry. We're in crisis mode right now in this country. But at the end of the day, how are you preparing your organization to weather that storm, set priorities, goals, set your organization up for success, continue building, doing the things that you're doing in this unprecedented time?
Yeah, so first and foremost, and a lot of that goes back to my physician background, is we want to make sure that we're still focusing on providing high quality care for the community. We know that you're always going to need that local grocery store,
Right.
even if Amazon's in town.
It's true.
So same thing with healthcare in rural areas. So that is first and foremost what we're doing. And then on the back end, we really are looking at all the possible scenarios based upon the legislation that's out there in terms of funding as to how we could weather the storm. And also looking at community partnerships. We've really doubled down over the past year on our foundation, which was relatively inactive prior to that. And have brought in a full-time director, which has really helped leverage a lot of community support for the hospital to ensure that it's there for years to come.
Yeah, that's huge. What would you say the percentage of population of Medicaid? Is it pretty high in your community?
It's actually not. We're very fortunate. But combined between Medicare and Medicaid, we're close to 70%.
Oh, that's huge.
So we're very dependent between those
of
two.
the government payers. Yeah, and the commercial rate, of course, is very low in those communities because industry and manufacturing and the opportunity for that. So all those things constant, what advice would you give to the listener today of what they can do to lift their voice?
Yeah, they certainly can reach out to their local governmental officials at the federal and state level.
That's right.
They're out there. They want to hear from you. They're representing you. So be sure to reach out and make sure that they need to understand that healthcare still occurs locally, and they need to make sure that rural healthcare remains, because without it, there won't be much in the community, as we also are usually the largest employer in the area.
Yeah. Are you the largest in your areas?
In terms of overall employees in the service industry,
Yes.
absolutely.
Yeah.
In terms of full-time jobs, yes.
All that's at risk. And our listeners need to understand the value of advocacy. It's very, very important. Well, let's transition into our last question. So what's exciting for you in the next program year that you have, the next 12 months, as you look at it, for you and your organization?
We've got tons going on over the next year. We're looking forward to breaking ground here on 90,000 square feet of clinical space for our facilities to support all those new specialists that we've brought into our community.
Did you raise the money for that, or are you still?
Well, it's several fold. So there is, a component of putting up dollars, but we have been working for over 2 years with the USDA to get a loan through them, which will be how we're ultimately
Congratulations
able to do that.
on that. We were able to do that as well. But if we have a listener in your area that's listening, you're not going to deny any donations, right?
No, absolutely
not. They
not.
can probably go to your website to find that spot.
So our foundation is always willing to take money. Don't worry about that.
Absolutely.
But we do appreciate the support towards that campaign as well.
That's going to be incredible. Great service to your community. You're doing a great job up there. What I appreciate about your perspective is you're at the bedside, you're delivering care, you're seeing your patients, and then you get to go back and make policy that impacts them. It's a little different perspective than most hospitals face.
Absolutely. And I think there's a lot of value to that. So I will never give up seeing patients, trust me.
Good for you. I'm glad you're doing that. Thanks for joining us today. We've gained so much insight through our Summit series, and we hope our listeners have too. Let us know if you've enjoyed the series in a podcast review, or email ruralhealthtoday@gmail.com. Until next time, remember the power of rule. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.